you for coming in today to talk about your condition.
Well, thanks for seeing me.
George is a 68-year-old retired coal miner who came in with cough, shortness of breath, chest tightness, and gray sputum.
Yeah, I have this cough and this tightness in my chest. I thought it was a heart attack, but y'all said I had pneumocoinage or something like that.
Yes, George, you have coal miner's pneumoconiosis. According to Capriati, this is a condition where coal dust enters the body. Once it enters the body, it cannot be destroyed or removed. So you have about 1 to 2 millimeter diameter pieces of coal in your lungs. These foreign particles, the coal, are engulfed by macrophages, which release chemicals that eventually cause inflammation and fibrosis.
I'm sorry. What does that even mean?
Well, basically, this means you have black lung. Over long periods of time, you inhaled a lot of coal dust into your lungs, and this dust got really deep down and caused damage to the little air sacs that our blood gets the oxygen from. The lung tried to clean itself, but the coal is heavy and hard to get out, and the longer you were down there, the more coal dust built up. But part of the process of the lungs trying to clean the dust out can cause swelling, and in some cases, the swelling and damage can actually cause scarring as well.
But I don't understand. When I stopped working in the mines, I was fine. But now that I've retired, sold my house, and moved all the way out here to the West Coast to be near my daughter, I've been here almost 6 months. But now I start getting sick. I don't get it. Why wasn't I sick when I was working?
I totally understand your frustration, but these symptoms can take years to develop and start causing problems. At first, your lungs might be able to keep up with the dust, but as they work harder and they take more damage, they start to slow down. But the dust doesn't stop. As your lungs stop being able to keep up with the dust, more damage is caused, which slows them down even more, which allows more dust to accumulate. This cycle can take years, if not decades, to show up, which is probably why you just now started having symptoms.
Well, what medications do I need to be on? What are you going to do for me? How are we going to fix this?
Well, according to Lippincott Advisor, the damage from the coal dust is irreversible, but certain steps can help slow down the progression of the disease, relieve symptoms, and improve your quality of life. The course of action will depend on how severe your case is. Your doctor may prescribe medication, breathing treatments, or a pulmonary rehab program. The goal is to increase your quality of life. Oxygen can be prescribed to help you get more air into your lungs as the scarring becomes more severe. That will be on an as needed basis. At this stage, your best bet would be to avoid other lung irritants, especially cigarette smoking. If you are a smoker, it is strongly advised that you quit. The American Lung Association offers a variety of smoking cessation programs to give people the support they need while trying to quit, and we are here to support you as well.
Well, I guess that's that then. Better quit smoking. Well, thanks for explaining it for me. I do appreciate. Hi, thank you for seeing me about my cough. This is just the worst.
Yeah, not a problem, Patel. It's my pleasure, and Nina's as well. We are both here to explain what is going on with you. Let me just confirm with you the symptoms that brought you in to see us was a productive cough and drenching night sweats.
Yes, I moved here to study English about 3 months ago. I do miss my housemates, though. We always took care of each other when we were ill, which, with seven of us, happened a lot. We would pass colds around all the time.
Patel, Kylie and I discussed your symptoms. We suspect it's tuberculosis.
That's right. Do you know much about TB?
No, not really. Is it bad?
Well, it certainly isn't just a normal cold, but we're here to help you understand. Kylie, could you explain to Patel what TB is and how it works?
Yeah, absolutely. According to Capriati, tuberculosis is an infection caused by the Mycobacterium tuberculosis. It most commonly affects the lungs, but it can spread to other parts of the body like the lymph nodes or adrenal glands. There are 3 stages of TB: exposure, latent, and active disease. People most often acquire TB by inhaling the bacteria when around an infected person. Commonly, the bacteria settles deep into one lung. Latency is when you have been exposed to the bacteria but do not have an active infection. The bacteria is dormant. Active TB is what you have now. You are symptomatic and capable of spreading it.
I'm sorry. I came here to study English, so I don't quite understand everything you said.
Basically, the bacteria that is in your body is actively making you sick. Your immune system is trying to combat the bacteria that are now alive in your body. Your immune system's response to the bacteria is why you have symptoms all of a sudden.
Why did I get the bad kind instead of the one that doesn't do anything?
It's possible your TB was latent, but it turned into active TB due to your move and starting school.
How would moving or starting school make it change?
Well, moving to a new country and starting a new school, finding somewhere to live, and all of that was very stressful, I'm sure. Sometimes when we're really stressed, the hormones in our body release to help with that stress, such as cortisol. And cortisol can cause our immune system to become a little bit weaker. And this could have allowed the latent TB, or the germs that were sleeping, to become active.
So, how do we treat it? I want to get better.
Totally. Well, your doctor will probably recommend antibiotics. It could be one or a couple of antibiotics. According to Lippincott, it's more common to be on several antibiotics to effectively treat active TB rather than just taking one. And it's important to remember that your treatment could take 6 to 12 months.
Well, thank you.
Good afternoon, Emily. Thank you for making time for us. We heard back from the doctor, and while we do need to do some further testing, he strongly suspects that it's a sleep disorder breathing.
What's that mean?
Sleep disordered breathing can mean many things and involve many symptoms, including increased resistance to airflow through the upper airway, heavy snoring, or marked reduction in airflow. It can also mean that you can completely stop breathing for periods of time. This can lead to a lot of complications, but the most common is arterial hypertension.
I still don't understand.
Emily, it can be a lot to take in. Let me see if I can explain it in a different way. SDB, or sleep disordered breathing, is when you either stop breathing while sleeping or your breathing is greatly reduced. The most common reason for this is obstructive sleep apnea. Have you ever been laying on your back and it feels like your throat isn't staying where it should? Like it maybe feels like it's falling like backwards and into itself and kind of choking you?
Yeah.
Well, that is what's happening here. When you're sleeping, you don't know to do the things to keep yourself breathing regularly, like changing positions or tensing certain muscles in the parts of your throat. So, those parts of your throat actually block or partially block your airway. So, when your throat relaxes, it makes getting a good breath a lot more difficult.
That's right. And these issues can actually cause a lot of other problems with the rest of your body. The reduction in airflow can cause your heart to work harder than it's meant to in order to get oxygenated blood to the rest of your tissue. When the heart beats harder, faster, or both, you end up with hypertension.
Hypertension. You mean blood pressure. Like high blood pressure, me choking in my sleep can cause that. But when it gets bad, I wake up and take a good breath, then I'm fine again. So I don't understand how this causes high blood pressure, even when I'm breathing fine. Would my blood pressure go down then? Why is it staying high?
I understand your confusion on this. So it's a long-term cumulative effect. Every time your heart has to beat harder or faster, it works the heart muscle. Eventually, the heart gets really strong, but because of the rest of the body isn't keeping up with the heart, it can cause problems. Things become unbalanced, and one of those things is blood pressure. Pretty soon, the heart, and usually the left side, only knows how to pump super hard. And this means that even when you are resting, the heart is still pumping harder than it should, creating an increase in pressure in your arteries.
Oh, okay. So all these years of snoring, it was just me not breathing well, making my heart work too hard, and now it's stuck working way too hard, giving me high blood pressure. Okay. Thank
Yes,
you for explaining.
no problem. And Bob, I have Nina here with me to help explain the technicalities of what's going on.
Good afternoon, Nikki and Nina.
Hi, Bob. It's so nice to meet you. I just want to go over a few things with you. I see that you're 78, have hypertension and diabetes, but both of those are well controlled. And you used to smoke. Does that all sound correct?
Yes, ma'am, about 2 packs a day for 50 years. My granddaughter kept bugging me about it, saying she didn't want her daughter around me if I always smelled like cigarettes. She's pregnant, see, first great granddaughter, so I finally quit. I thought she'd never get off my back about it.
I see. Well, congratulations on your great granddaughter. Let's take a look at what's going on here so that you can enjoy her once she's born. Now, Bob, you came into our office because of worsening shortness of breath. Have you ever heard of COPD?
Yeah, I got a couple of old poker buddies that have that. They walk around with oxygen tanks all the time.
Well, we believe that you have COPD, but that can actually mean one of two things. It can mean you can either have chronic bronchitis or emphysema.
Those are the same thing, aren't they?
Not quite. Chronic bronchitis is where the bronchioles are inflamed, reducing airflow, and with emphysema, the alveoli are damaged, creating larger air sacs with less surface area. This reduces gas exchange.
So in bronchitis, parts of my lungs don't work. And with emphysema, parts of my lungs don't work, but they're different conditions.
Um, I'm gonna chime in, Bob. Are you familiar with how snorkels work?
Yeah, like a big straw that lets you breathe underwater.
Right, Bob. So chronic bronchitis is like the snorkel tube being too small. No matter how much you try to breathe in, it's going to be hard because the tube just isn't big enough. The bronchioles, or the tubes that let air get to your lungs, are swollen, and this makes it hard for air to get in and out. Emphysema makes it hard to breathe because the little air sacs at the bottom of those tubes are damaged. Like if the mouthpiece of the snorkel was damaged in a way that made it too big, so you couldn't actually get your mouth around it to get the air. And now, chronic bronchitis usually has mucus, a cough, even sometimes a fever. And emphysema's main symptom is shortness of breath, but doesn't usually come with the other symptoms.
So you don't know which one I have. How do you find out?
Well, according to Lippincott Advisor, the doctor is going to run a few different tests that will show your lung function on different levels, like how much you can breathe in and how hard you can breathe out, as well as a few others. And based on those results, the doctor will be able to tell if you have chronic bronchitis, emphysema, or both.
The test that Nikki mentioned is called a spirometry test, and this is going to determine the disease stage, or in other words, how far along the disease is, and that way we can more efficiently guide your treatment plan.
I probably should have stopped smoking when my granddaughter asked me all those years ago. I just hope I'm around long enough to see her baby and make memories with her.
Annie, thank you for joining us today. I have Kylie here with me to help explain things. Kylie, this is Annie. She's 22 and just moved in with a new roommate. Now, the roommate has a cat, and Annie has some medical issues regarding that.
Hi, Annie.
Now, Annie, the doctors diagnosed you with allergy-induced asthma. Do you know what that is?
Not really. I just know that sometimes it feels like I can't breathe and it's really scary.
Asthma can be terrifying. I have it myself, and I rarely have felt anything scarier than not being able to get enough air. I'd like to explain to you what is happening to cause that reaction.
I would love that. I really don't know what's going on.
Wonderful. Well, according to Capriati, when a piece of foreign material enters the body's immune system will evaluate it. And if it's a threat, like bacteria, it will initiate the immune response. A lot of times this happens when the material is not a threat, like cat dander. We call those allergens. When the immune system detects an allergen, the body starts producing IgE and things called inflammatory mediators, including histamine. The histamines cause capillaries to swell. The expansion of capillaries allows white blood cell rich plasma to access the foreign matter in order to destroy it. When you breathe in the cat's dander, the dander lands on your airway and your immune system goes into overdrive. The IgE releases histamines, swell your blood vessels, which allow more fluid to leave your blood vessels and enter into other cellular spaces. That extra fluid in the tissue is the reason your bronchial tubes swell and you have an asthma attack.
Um, okay, but what does that actually mean? How do I get my IG or histamines or whatever you just said not to freak out anymore?
Well, Annie, it means that your body sees the cat dander as a threat. So when it notices cat dander that you have breathed in, it goes to war. The troops, the white blood cells, are sent to the battle along with supplies they need, like fluid. That fluid seeps out of your blood vessels and into the surrounding tissue. This is why your airways swell and you find it hard to breathe. An inhaler, like the albuterol inhaler, is basically sending the all clear to the histamines, the generals in this war analogy, and letting them know the threat is over and to recall the troops, the white blood cells, and the extra fluid. An allergy pill disrupts the communication between the scouts and the generals. The generals never even know the foreign matter is there.
That makes a lot more sense. Thank you. So, does that mean I just take pills forever and always carry an inhaler? I really like this roommate. Are there any better options out there for me?
Of course. So according to Lippincott Advisor, there are some different options such as allergy shots to teach your body that the foreign matter, the cat dander, is not a threat. Your body learns this and remembers it. So even after you stop the allergy shots, your sensitivity to the cat dander can remain low for quite some time. Now, they are a little more expensive than an inhaler and some Benadryl, but because they last for such a long time, it may be cost effective for you. It's worth looking into at the very least.
Cool. Thank you so much. I'll look into that.
Of course. Hi, Mary. I'd like to introduce you to Kylie. She's here with me to help answer your questions today. Kylie, to fill you in, Mary is 47 years old and came to our emergency department today because she's having a really hard time breathing. She's in a newer relationship and recently started a hormonal contraceptive and just drove back from Las Vegas. She made it here in about 24 hours.
Wow, Las Vegas to Minnesota in a day? That's a lot of time sitting in a car.
Yeah. So the doctors diagnosed Mary with PE or pulmonary embolism. Mary, have you had those or know what those are?
No, what are they?
According to Capriardi, a pulmonary embolism is a clot in the lungs. These clots usually develop deep in our large veins, like in the legs. Our bodies make blood clots all the time, usually small ones, and they're critical to keep us from bleeding when we shouldn't. I'm sure you've noticed when you've cut yourself, the blood eventually clots and the bleeding stops. Now, this is exactly how it's supposed to happen, and the body eventually breaks down those clots so they don't cause any issues. But sometimes the body can't break down those clots fast enough or at all. And this is when things get scary. So, the first thing to understand is that when we're moving around, like walking, we're running, that physical movement in the muscles is helping to push the blood back up from the lower legs into the body cavity towards the heart. When we're immobile for long periods of time, this process is disrupted. The venous return is slowed, and when blood moves slower, it's more likely to clot. I suspect you formed a clot deep in the veins in your legs called a DVT or deep vein thrombosis, and parts of this DVT broke off once your normal activity was resumed. That's called a thrombus. This thrombus was then traveling through your body. As the blood flowed from your legs to your vena cava and to the heart, the clot flowed with it. The blood then entered your heart and was sent to your lungs for oxygenation. The clot went with it as well. The vessels in your lungs eventually get smaller and smaller as they branch out into the bronchial tree, and eventually the thrombi will reach a vessel that is smaller than the clot. At this point, the clot stops and becomes a pulmonary embolism.
To summarize this, Mary, because you were sitting still and not moving your legs for so long, the blood flow slowed and allowed some of the blood to clot. Part of this clot broke off and traveled to the small vessels in your lungs and stopped the flow of blood, like a semi-truck trying to go under an overpass that is too low. The truck doesn't fit, gets stuck, and this causes a huge traffic jam behind it. This is what happened in your lungs.
So, is this just because of a long car ride? You mentioned birth control. What does this have to do with that?
The car ride is a big part of it. There are a few risk factors at play here, including sitting without moving your legs for a while and hormonal birth control. Like we talked about before, the blood in our legs need to get back to our heart and lungs so it can get some more oxygen, and the muscles we use to walk help that process a lot. According to Capriati, taking birth control also increases the risk because the birth control tells your body to make more fibrinogen. That protein is a major player for clot formation, ability to clot, and the long period of time you spent sitting slowed down your body enough to take advantage of all that clotting potential. Birth control combined with a decrease in movement is a recipe that often leads to clotting, and once a piece of that clot breaks off, it could end up in your heart as a heart attack, your brain as a stroke or in your lungs, like in your case, and we call that a pulmonary embolism.
Well, is this just going to keep happening?
According to Lippincott, we can do a few things to keep you safe, such as get you started on an anticoagulant. This will prevent more clots from forming until your body can break down the clots you have. We can also look at the risks and benefits of a clot dissolving drugs such as alteplase, or even placing a filter above the clot to catch any pieces that break off before they get into anything vital, like your heart, your brain, or your lungs. And your provider will discuss all of those options with you.
Well, that's a lot to think about. Thank you so much for explaining everything to me.
No problem. Hi, Sarah. I'm sorry you're feeling so under the weather, but we have some good news. We know what's going on and we have a plan to fix it. Kylie and I are going to answer your questions and hopefully get you on the path to feeling better. But let me confirm, Sarah, you are 24 and came in today with a harsh cough that has caused some chest pain and 101.5-degree fever.
Yeah, that's right. And I just can't stop coughing. It hurts so bad when I cough.
I can understand why. Sarah, you have pneumonia, which is a bacterial infection that affects the lower respiratory system. It usually starts as a cold, but then the bacteria travels down into your lungs, and this creates an immune response. The alveoli become inflamed, which allows for more fluid to pass through the epithelium, and this stimulates the goblet cells to increase mucus production, resulting in the space between the capillaries and the alveoli being filled with mucus, white blood cells, and infection. The oxygen can't move into the bloodstream because of the pus surrounding your alveoli.
What this means, Sarah, is that the infection has moved deep into your lungs. The blood capillaries lay against the alveoli, or little air sacs, and they trade good gas for bad gas. It's like a screen door and you just burnt something in the kitchen. The bad air can leave and the good air can come in. Now imagine that the screen door was covered in thick, wet paper towels. It's going to make it hard to breathe, and some of the fluid can actually end up in those little swollen, sick air sacs, the alveoli. Your lungs are irritated, so they want to cough, and when you breathe deep or cough, those little air sacs pop, leaving all that fluid, we call it phlegm, in your lungs. That is what you're coughing up.
So is this kind of like when I have a chest cold? Once I stop coughing, will I feel better in a day or two, or am I going to be popping air sacs and coughing up phlegm for a long time?
Well, unfortunately, pneumonia can take a little longer to heal. See, pneumonia actually causes a bit of lung damage, and that takes time to heal. You're not just getting rid of the phlegm, but actually healing damage from all of those air sacs popping. They need to regrow and repair themselves. According to Lippincott Advisor, after 1 week, your fever should be gone. After about 4 weeks, your chest should feel better and you should produce less mucus. After 6 weeks, you should cough less and find it easier to breathe. After 3 months, most of your symptoms should be gone, though you may still feel tired. And after 6 months, most people will feel back to normal, but for some, it may take longer. We will get you started on some antibiotics, and that should help you start feeling better soon.
So, since I can walk, is this walking pneumonia? What's the difference between the two types?
That is a fabulous question. But no, this is not walking pneumonia. That's actually caused by Mycoplasma pneumonia, and yours is the more common community-acquired pneumonia caused by Streptococcus pneumoniae. Symptoms of walking pneumonia are usually a lot lighter, and recovery is typically a lot faster. But with a bit of help with some antibiotics, such as amoxicillin, we're going to get you back on your feet as soon as possible.
Cool. Well, thank you guys so much for explaining this to me.
It was our pleasure. Thank you.
Everybody, my name is student nurse Kylie, and I'm joined by fellow student nurse Nina. Today we are here for Ross, who is 22 years old and fractured his 7th rib while playing football. This rib fracture caused a traumatic pneumothorax. Ross is now stable and has some questions for us about his condition. First, I'll explain what a pneumothorax is and how it works. Then we will move into what that means for you as far as recovery. According to Capriati, a pneumothorax is when the lungs or lung collapses because the air on the inside of the lung is weaker than the pressure on the outside. This can happen when a hole in the lung leaks into the pleural space, but the air has no way of existing or exiting the body. The air builds up, increases pressure, and pushes on the lungs past a point where they can remain inflated.
I don't know what any of that means.
That's okay, Ross. I'll explain it a little bit differently. Kind of like what Kylie said, a pneumothorax is when a lung collapses because there is air inside your chest, but not inside your lung. The air bubble inside your chest can move things around and even squish your lung, causing your lung to collapse. Your rib popped a small hole in your lung which let air leak out, and this means the inside, which usually has more pressure, leaked into your chest, and because that air had nowhere to go, it kept building. Eventually, that pressure outside of your lung was higher than the pressure inside your lung, and it squished your lung down, forcing it to collapse.
Oh, so that explains why it hurt so bad and I couldn't breathe very well.
Yes, Ross, exactly. And according to Lippincott Advisor, we fix this by inserting an intercostal drain. This allows the pressure in the pleural space to return to normal, which allows the pressure in the lungs to increase, reinflating it and returning your lungs to normal. Keep in mind that when you're feeling a lot of pain from a broken rib, it may affect your breathing and therefore your oxygenation. So our top priority right now is to manage your pain. The puncture was quite small in nature, so we are able to let it heal on its own since you live close to a hospital. The rib is reduced and should heal all on its own as well.
So except for this tube in my side, you're not gonna fix me. You're not gonna fix my bone. I'm just gonna have a hole in my lung forever with this tube just keeping it from collapsing again.
Well, the puncture was actually really small, so we would expect that to heal in a few days' time. The tissues will knit back together, and over time will heal enough to seal the wound. Then we can take the tube out. The bones will take a little longer to heal, but the lung will feel better a lot faster. Breathing should return to normal as long as you keep up with your breathing exercises and can keep your pain under control.
Okay, well, thank you. I feel like I understand it a lot better now, and I can't wait to feel all the way better and get back to the team. Thank you.